All right, so hey you guys, look, I'm here with my friend. I'm so lucky to have friends in high places.
Ah, I'm the lucky one.
This is my dermatologist, Dr. Whitney Bowe.
Hey guys.
And you've probably seen her. She's a lot of Good Morning America. I've seen her on Rachel Ray's show. I see Dr. Ross. I mean, you do a lot. You're all over the place.
Yeah, it's fun.
Yeah,
Keeps me on the cutting edge of everything.
Yeah.
So makes me a better doctor.
And I like how so you know, you've been treating me for a while, I guess over a year now. And one of the things that I was talking to you guys about is that I just turned 54 years old, and I am a woman of color, in case you didn't notice.
Looking good.
But signs of aging are different in people of color.
Exactly.
And that's what we were talking about earlier. So.
Right. Whereas somebody who has Caucasian or very fair skin might show fine lines, wrinkles, sagging. You know, with skin of color, oftentimes the complaints have more to do with discoloration. You know, uneven sort of patches that are darker or lighter. So we sort of address those things a little bit differently. You know, when it comes to sun protection, that's key for anyone, no matter what color skin you have, because UV rays can make the skin more uneven and can trigger your pigment cells called your melanocytes to pump out pigment and actually stain the skin. So that can lead to, sometimes it almost looks like you have a mustache, or sometimes you have a little bit of discoloration on the cheekbones or on the forehead area. So sun protection is key for that, but then you want to do things that are going to lighten up the brown spots you already have, because sun protection prevents, right? But sometimes we got to reverse some of the damage. So with Rene, you know, we tend to do chemical peels, very gentle. We're talking very light, you know, 5-minute peels, no downtime, you know, with very gentle ingredients, medical grade. This isn't what you can get in an esthetician's office or at home. So we're still talking about more powerful than, you know, something over the counter per se. You know, but it really, you don't have a lot of downtime from it. I think a lot of people are worried with peels, like their skin's going to look raw and they're going to have downtime, they're not going to be able to leave the house, and that's not true at all.
So what we're looking at for me is, you said I'm a little bit dark through, like over my, like right in here.
Yeah, so a lot of people have a little bit of a stain appearance.
Here I thought that was the mustache.
To their upper, and sometimes there's a combination of both. Sometimes it's a little bit of hair, and sometimes it's actually a stain, and that can be a sign of melasma. So women, we have estrogen, and then we see the sun, and the combination of estrogen plus the sun can bring out a condition called melasma, which is very, very stubborn. And one of the classic places for melasma is across the upper lip. If you tend to wax, or if you use like, you know, any of the chemical depilatories there, any of that trauma, that heat from the wax, or, you know, the chemicals from the chemical depilatory, like, you know, something that's going to remove that. Sometimes if you overdo it a little bit, it can actually make that darkening look worse. So sometimes when you're treating the hair, you end up staining the skin.
You know, it's funny because I don't use any of that. I just use an old razor. I just shave. No, I'm kidding. I'm kidding.
And some people do that too. And sometimes even the razor, which is common. You know, my mom, hi mom, I love you dearly. My mom totally shaves her face. Like, I mean, a lot of people do. It's easy, you know. But even just, you know, pulling that razor blade over the skin can sometimes trigger your pigment cells to produce a little bit more pigment. Okay. So you got to be really, really gentle in those areas. Okay. You know, and other areas, we were just talking about the fact you wear sunglasses all the time. Right?
So it's right here.
And if you look at the bridge of your nose, you know, there's 2 little brown spots there, and that's just from the friction, from rubbing. You know, your skin cells are trying to protect themselves by pumping out more pigment, more melanin, and it stains the skin.
Yep.
And then you can see there's usually more of an uneven discoloration on the left side of the face as compared to the right side in the U.S. Because when we drive, the light is coming in this window, but in the UK, they tend to get more discoloration on the opposite side.
How interesting.
So it is sort of fascinating. So we're just going to do a quick chemical peel.
All right, so here, we're going to turn this around. See what, okay, how's that? And then you can get a good, this is Jen, right?
Yeah, the camera. And Jen is awesome. We love Jen.
So I'm holding the little fan. Okay.
Jen is brilliant and does all of this for me. Thank you, Jen. She does my chemical peels at the end of the day.
Oh, wow.
So we got a fan just to ease the discomfort, because sometimes you can feel a little bit of a tingling, stinging sensation with a peel. We have a timer because we want to keep an eye on the time when we're doing a peel.
Okay.
And I'm going to have you close your eyes. We've actually prepped the skin. Jen prepped the skin prior with a little bit of a toner to sort of just make sure that the peel is going to evenly penetrate across the surface of the skin. And then she actually put a little bit of Aquaphor right into the corners of the eyes, the corners of the nose, and the corners of the mouth, in order to prevent the acid from the chemical peel from pooling in those areas and creating irritation. So she actually deliberately protected those areas before we even started the peel. But the whole thing, even with those added steps, takes about 5 minutes from start to finish. So
I like Aquaphor. I
love Aquaphor, especially during the winter with the dry heat coming out of the radiator. It's a great product.
So it feels a little like
I'm just going to do your upper lip for a second here. Now we did one pass, so now you've been covered the entire pass. So scale from 1 to 10, where would you say you are? 10 being like childbirth, oh my god, I'm in agony. 1 being I barely feel it, what's going on?
I would go with 1. It doesn't
so it's
feel
very subtle, it's a very light tingling. That's a good sign. For me, that means that I can actually do a second pass in certain spots. So what I'm going to do is now I'm going to do a second pass just in the areas that are darker. So I'm going to go over those areas.
And then once this is done, is there any kind of special...
So you really want to keep your skin out of the sun for about 24 hours. So we'll apply a moisturizer with a sunscreen before you leave the office today.
Yes, if they're asking questions, yes, please.
Someone wants to know if this is a Vi peel.
No, this is actually a free acid glycolic chemical peel. And so you want to look for, the percentage only matters if it's unbuffered. Like it's a little bit complicated when you choose a peel. This is a glycolic acid peel, but if it's 30 or 40% and it's unbuffered, that's a pretty intense peel. You can get a 70% peel from your esthetician that's buffered, and then it barely feels like you're using anything. So it's a little bit hard to just look at the number and know what you're getting. And this is a straight up glycolic peel. So, sometimes I'll do just glycolic by itself. Sometimes I'll mix it up with other alpha hydroxy acid. Sometimes, we'll use more sort of combined approaches to the peel. Sometimes I'll do microneedling before I do a chemical peel.
That's my next.
Yep.
I'm going to do that. I'm definitely going to do that. I really want to. Because I used to do the microdermabrasion and I loved it, but then we got educated about that.
Right.
You educated me about that.
So
it feels like I feel it on my forehead, but not more than, say, a 2 or 3.
Okay, great. So in general with a peel, when you get to be above a 7, then you want to neutralize the peel. Or your doctor who's doing the peel should be looking and seeing if there's any areas that are intensely pink or red, or worst case scenario, turning white. Those are signs that you need to neutralize that peel right away. I'm not seeing any of those signs. I feel like your skin's tolerating this very well. We're getting an overall, just a little bit of a flush, a little bit of a gentle, pinkness to the skin, which is much more subtle in Skin of Color. So you have to go to somebody who's trained for looking at it in Skin of Color, because when you get a sunburn, it's not so obvious, but your skin can be really in pain, and then, oh my god, I really got a bad sunburn.
Yeah, I think that people don't understand that there's a bit of, you really have to take care with Skin of Color.
Yes.
Like the hyperpigmentation that can happen from acne scars or or damage, things like that.
The 2 best things if you're going to start to do anything new in your regimen to prevent against this is to get an antioxidant serum and to get broad spectrum sunscreen and make that a part of your morning regimen before you leave the house every single day, rain or shine, winter, summer, because even on a cloudy day, you've got 80% of the UV rays are penetrating through those clouds and doing damage.
I like Anthelios.
I love it.
That's my big sunscreen, and I've been using that it's expensive. It's like $30 for a tube, but I love
it fast too. So we're applying a
what can we
neutralizer now.
safely do about loss of volume as we age?
So with loss of volume, there are some topical products now that actually do lift and plump in a very subtle way. So if you're not ready to, go down the injectable route with needles, there are some products that do that. One of the ones that I love is Dr. Brandt actually has one. It's a 3D sort of plumping mask that you can wear, and you actually put it in a triangle on the cheek area to sort of lift and plump there. So there are some products topically. It's not dramatic. It's not going to lift the way that a filler can in the office, but it's certainly a good place to start. Other things you can do, there are, obviously when I use fillers, I use things like Juvederm Voluma, Restylane Lift. There are lots of different products that are beautiful for lifting and giving you a more dramatic lift right away. But then there's also devices that I use too. So I can use Ultherapy, which is highly focused ultrasound. I can use thermage or radio frequency. I said devices. You can use now, there's a new procedure that I'm doing a lot of. It's called the Intensive. It's a micro needling radio frequency device, and it's colorblind. So that's something maybe we can even do for you guys next time.
And what is the purpose of microneedling?
So microneedling is amazing for the texture. So it helps make your pores literally just look flawless. It's great for tone, texture. It's great for evening out sort of all the superficial imperfections of the skin. But when you combine it with radio frequency, it actually gives a lifting effect. So a lot of people have like crepey neck skin, and then if you combine those two, you get like a lifting, tightening, and you get a smoothing out of the texture.
So, do you really need sunscreen when you spend very limited time in the sun?
So yes, but you can go with like a broad spectrum SPF 15. So you don't have to go with like an SPF 30, like the type of sunscreen that you'd use when you go to the beach. But you do want to look for a broad spectrum SPF 15 or above, and it could be as part of your moisturizer, it could be part of your primer. You know, it can be a very cosmetically acceptable product that you tend to, like, you layer your makeup on top of it very easily. But absolutely, even if if I'm literally leaving the house to drive to the office, you know, on a cloudy day, I am absolutely not leaving unless I have sunscreen on my face.
I mean, I'm always shocked by that people go out without sunscreen on, period. Like, I've been wearing sunscreen since my mom.
That's why you look as good.
So Debbie Brooksaber said, "Hi Whitney, one of my college
Debbie
friends."
Brooksaber.
How are you? We both love Debbie.
Oh, you know Debbie?
Yeah, we know Debbie.
Oh my gosh.
We love you, girl.
Yes,
How are you?
Debbie. She's the best. Yeah. Were there any? Who else has questions? Anybody else?
No, I asked mostly all of them.
All right, well, we're all neutralized, so we're going to just put
Wow.
on a little bit of moisturizer with sunscreen,
Yay.
and then I'm going to kiss you goodbye. So thank you guys for tuning in. Thank you for having me.
Thanks, you guys. Bye.